allergy awareness, and Epipen use. There are many common food allergies in children: milk, eggs, peanuts, tree nuts, shellfish, fish, soy, and whey. Allergy statistics. Researchers believe that the prevalence of food allergies is increasing, and the number of deaths from food allergy-induced anaphylaxis is growing. Children are the largest group of the population affected by food allergies. 6 to 8% of U.S. children have food allergies. 1.2% of U.S. children have peanut allergies. 1.3% of U.S. children have egg allergies. 2.5% of U.S. children have milk allergies. Peanut allergy is the food allergy most commonly associated with anaphylaxis. Peanut anaphylaxis accounts for 30,000 emergency room visits per year, 150 deaths per year from peanut and tree nut anaphylaxis. What is an allergy? An allergy is an abnormal response to a normal substance. This is the body's attempt to defend itself against substances that are perceived by the body to be harmful, an allergen. There are various degrees of reaction. Symptoms can occur up to 72 hours or more after exposure to the allergen and can last up to several days. Symptoms may or may not be life-threatening. Allergic reactions could be caused by certain foods, some drugs, bee stings, and products, especially latex. Allergic reactions. Skin contact reactions, for example, to poisonous plants, animal scratches, pollen, and latex. Injection types of reactions, for example, to bee stings. Ingestion or swallowing, such as taking medications or reactions to nuts and shellfish. And inhalation allergies, such as to pollen, dust, mold and mildew, or animal dander. What is anaphylaxis? Anaphylaxis is the life-threatening form of an allergic reaction. According to the American Lung Association, it is a sudden, severe allergic response that usually produces breathing difficulties, collapse, and even possible death. It usually occurs 1 to 15 minutes after exposure, rarely after 2 hours. It requires immediate action with an EpiPen. You may check for more information at the website as listed, www.allergic-reactions.com, for a video demonstration of EpiPens. Symptoms that can occur during an allergic or anaphylactic reaction. For the skin, hives, swelling, itchy red rash. For the gut, cramps, nausea, vomiting, diarrhea, gas. For the neurosystem, weakness, impending doom feeling. Respiratory, itchy watery eyes, runny nose, stuffy nose, sneezing, cough, itching or swelling of lips, tongue, or throat, changes in voice, difficulty swallowing, tightness in chest, wheezing, shortness of breath, repetitive throat clearing, cardiovascular symptoms, reduced blood pressure, increased heart rate, shock, pale and sweaty. Allergic reactions versus anaphylactic reactions. Anaphylactic reactions include hives, swelling of face, lips, tongue, throat, upper airway, difficulty breathing, such as tightness of the chest, vomiting, diarrhea, cramping, difficulty swallowing, voice changes, weakness, paleness, sweating, feeling of impending doom. Allergic reactions, runny nose, itchy red watery eyes, local reaction to the sting unless known to be allergic to. Anaphylactic reactions. An allergic reaction can advance at any time to an anaphylactic reaction. An anaphylactic reaction can happen very quickly, usually 1 to 15 minutes after being exposed to an allergen such as nuts, bee sting, latex, or foods. Anaphylactic reactions can involve many symptoms or just one severe symptom, such as rapidly progressing hives, difficulty in breathing, or upper airway swelling. To recognize anaphylactic reactions, be aware of the students in your classroom that have life-threatening allergies. Be aware of what the student is allergic to: nuts, latex, bee stings, foods. Recognize the signs and symptoms of an anaphylactic reaction. Learn to use an EpiPen. Ask your school nurse for training. Respond to these symptoms. Do not ignore them. What to do when an anaphylactic reaction occurs in your classroom? Call the school nurse immediately. Identify the student and problem to the school nurse. Ask the student if they have their EpiPen on their person. Administer the EpiPen. Call 911. Do not send a student who you suspect of having an anaphylactic reaction to the health office. Call the school nurse instead to come to your classroom. She will bring an EpiPen and emergency equipment to assist the student. EpiPen instructions. EpiPens are easy to use. Remember, you must hold the EpiPen in place for 10 seconds. It will hurt, causing a burning sensation. Training is available through the school nurse. This action is covered by the Good Samaritan law. How does the medication help? EpiPen is epinephrine medication. It quickly constricts the blood vessels. It relaxes the smooth muscles in the lungs to improve breathing. It stimulates the heartbeat, works to reverse hives and swelling around the face and lips. It wears off in 10 to 20 minutes and sometimes requires a second dose. It is critical that 911 is called and the student is transported to an emergency room. Emergency action plan. Take all reactions seriously. Administer an EpiPen if you recognize a student's reaction as anaphylactic, or call a trained school staff member immediately to assist with the administration of an EpiPen. Call 911. Monitor the student's breathing and circulation. Administer CPR if needed. Notify the parent or guardian. The Good Samaritan law protects all individuals who administer an EpiPen from liability. Deciding to become EpiPen trained is a personal choice. If you make the decision to become certified, please see your school nurse. Certification involves reviewing the information packet provided, demonstration of EpiPen administration, and an understanding of allergic and anaphylactic reactions and how to react to those situations. The 3 R's for handling a reaction. 1. Recognize the signs and symptoms. Is the reaction life-threatening or not? 2. React quickly. Activate the student's emergency care plan. And 3. Review what caused the reaction and did the plan work. Evaluate the emergency action plan implemented. Any lessons learned? Any changes to the plan required?